Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Healthy Living Tuesday continues right here on KUM News Extra. And of course, we once again thank Liz for her contributions. But now we are dealing with a much more sensitive and probably for some of you out there, a much more gross topic, but important nonetheless. Now, Dr. Lom from Express Care, thanks once again for being here. We have a bunch of questions that people posted on Facebook about nasty nail fungus, ringworm, jaff-jaff, and other types of infections. So, are you up to this?
Yes.
Okay, it's around dinner time and everything, so, you got your medical cap on?
Got it.
All right, here we go. Question number 1, gentlemen, if you please, Jess from Tamuning asks Dr. Lom, how can I treat ringworm for my child?
Well, the easiest way is to pick up some over-the-counter Lamisil or other over-the-counter antifungal medication. Rub it in twice a day. Make sure you cover the entire area, not just the circle, but a little bit wider than the circle of the ringworm, and keep rubbing it in twice a day for 3 to 4 weeks. The big mistake people make is they treat it only for a short time, 3 or 4 days, and this is a slow-growing fungus. It takes a long time. I always mention that ringworm is not a worm, it is a fungus. Just like a hot dog is not a dog, okay?
So is that like just a fancy marketing thing that somebody like in the 20s made up because it scared people into not doing it?
I don't know where the word ringworm came from.
Okay, well maybe we'll have to look up the entomology or the history of that and everything. Yeah. That'll be next week's question. I'll post something on Facebook. Okay, speaking of which, our next question comes to us from the central village of Jitka. This comes from Maria, and she asks Dr. Lom from Express Care, I feel itchiness and bites under a couple of my fingers. Could this possibly be fungus?
Well, it could be, but it sounds to me more like scabies. Scabies is a parasite that affects people, especially between their fingers and between their toes, and becomes extremely itchy, especially at nighttime.
In the webbing?
Pardon me? In the webbing, in the webbing, yes. And so it sounds much more like that. Usually nail fungus is a painless condition. It's just very unsightly, sort of a yellowish discoloration under the nails and a thickening of the nail, a greenish discoloration sometimes, but there's no discomfort with it. It just looks really ugly.
Okay, yeah, that's scary. Anytime any part of the body changes color, that's kind of scary.
Yeah.
So. Okay, third question. Doesn't have somebody, so I'm assuming this is anonymous, but important nonetheless. Dr. Lom, is nail fungus contagious?
It is contagious, yeah, particularly on the feet within the same person. So, your shoes, your feet are in your shoes, and the nail fungus is traveling from one nail to the other. So it'll start on your big toe, and pretty soon all of your toes on one side are affected, and then moving to the other side. And then sometimes people also will be cleaning their feet with their nail clippers or whatever, and it will begin to affect their hands. So there's something called 2 hands, 1 foot syndrome, where the fungus is on your foot, and then you've been cleaning it with your 2 hands. Pretty soon, 3 of your limbs are affected. Oh, no.
Well, real quick, our friends in the military tell us often that, especially for soldiers out in the field, they tell them to change their socks 2 or 3 times. Do you recommend that for people in office places?
Yeah, definitely. So fungus loves to live in hot, moist and dark areas, and that would be inside your shoes, perfect area. So try to minimize. You can't do much about the heat and the darkness, but you sure can help the moisture. So try to change your socks, wear cotton socks, and you can also throw your shoes in the washing machine with a little bit of bleach once a week or so that you could fumigate and get rid of the fungus in there.
Good tip. All right, our next question comes to us from Liz's home village. This is from Agana Heights, and this comes from Mike, and he asked Dr. Lom, I have severe jaff-jaff on my neck. What do you recommend?
This is a very common condition on Guam, especially for people that work outside in the heat and they're sweating. One of the things is this is not due to poor hygiene. You're all clean, you wash, everything's fine, but you sweat. And when you sweat, that's the moisture that the fungus that is everywhere in the air, it loves it. So it'll land on you and create a home and give you the white spots. So a lot of people will be using Selsun Blue and so on. That does not usually work all that well. It tends to burn the skin. A better shampoo that you can buy is called Nizoral or ketoconazole. You can buy this over the counter. It's a 1% shampoo. You shampoo up your neck, you leave it on for about 5 minutes, and then you rinse it off. And you do that about 3 times a week. And you keep doing that for at least a month before you can expect it to clear up. If it doesn't, you need tablets by mouth.
Okay, and our very last question says, Dr. Lom, we go back to ringworm. What are the symptoms of ringworm, very quickly?
Well, generally there's a rash. It's a ring-like red rash with some scale on the outside of the rash. Sometimes it's itchy. It tends to be more itchy when you're hot and when you're sweating. Sometimes it doesn't itch at all, but usually there's a mild itch with it.
Okay, well, Dr. Lom, thank you for that very interesting information about some very, as you said, unsightly and potentially dangerous afflictions and everything. We'll see you next week.
Thank you.
All right.